The stay-at-home order is now lifted in the state of Texas, with the majority of businesses reopening this Friday. Doctors on the front lines will have to work to contain the spread of the virus as life begins to normalize in that state. Dr. Owais Durrani works in emergency medicine at UT Health San Antonio, and he's joining us now with an update. Doctor, first off, welcome to the show. Thank you so much for everything you and your colleagues are doing every single day. We really appreciate it. And, we're hearing about the coronavirus and how it's hitting hospitals really hard, especially here in the Northeast. Give us a sense, doctor, of your experience in San Antonio.
Yeah, absolutely. Thanks for having me. I would say, so I was talking to a colleague the other day, and the two words that came out were eerily quiet. We see these pictures from New York, and there's this madness. Here, I work at a level 1 trauma center. We normally have anywhere from 40 to 50 people in our emergency department when we walk in. The last 3 weeks, we've had between 0 and 5, and so it's been different. Obviously, a big part of that are the stay-at-home orders and our public health officials urging citizens not to come in for non-emergent conditions. That being said, every day we do see a handful of up to 10, some days critically ill patients, patients that need high doses of oxygen therapy, and patients that end up getting intubated and go to the ICU. So for the most part, it's eerily quiet with the sprinkling of some critically ill patients.
That seems to be good news, doctor. Do you think that's because local people are following the guidelines? And what are you and other doctors on the front line in Texas seeing? Is it these low numbers pretty much across the board?
Yeah, so I do think people are following the guidelines. I think once we saw what was happening in some of the hotspots across the country, implemented social distancing guidelines and some stay-at-home orders earlier on in that curve process. And so we did not have the degree of community spread that some of the other locations around the country had. And yeah, I've spoken to colleagues in Dallas and Houston and other places, and that kind of is the trend in Texas at the moment.
As you know, Governor Greg Abbott of Texas is allowing businesses like retail stores and restaurants and movie theaters to open as early as this Friday. Of course, there will be some safety restrictions in place, but how concerned are you about this?
To be honest, very concerned. We, as I mentioned, implemented these guidelines earlier on in the process, and there have been numerous plans for going back to quote unquote whatever our new norm will be. The president of the United States laid out a plan that recommended a 14-day gradual downtrend in cases, and we simply haven't seen that here in Texas. We are still having an increase in cases, although not at an exponential rate, but an increase in cases in all of our communities. And so it is concerning. The other thing that we need before we do go back to whatever our new norm is widespread testing. Last I checked, we have only tested about 1 to 2% of our citizens in Texas, and that's simply not enough. And then finally, we need antibody testing, and that is simply not widely available in our communities at the moment. So very worried.
With all those factors, doctor, do you think there will be an uptick in patients once the state reopens on Friday?
Without a doubt, yeah. What that will look like is really going to depend on how widespread the virus is in our communities, how strictly citizens adhere to social distancing guidelines, even when we do go back out into our communities. But there will be an uptick, yeah.
What do you want to tell the people in San Antonio and other parts of Texas as these reopenings happen across the state?
Yeah, I'd say kind of back to the basics. So social distancing, washing your hands, wearing face masks, all of those things are going to be more important now that we're, interacting with individuals that we haven't interacted with before. And the final thing I'll say is, my brother, for example, he works up in Michigan, but he's back in Texas now because they're working from home. And so I was having a discussion with him, even though some places might open up on Friday, don't go out there if you don't need to. So obviously we have the essential workers that, have no choice, and we're thankful for them. But if you don't need to go and be out in the community, don't put yourself or your family members and friends at risk.
Great advice, Dr. Owais Durrani. Thank you again for being on the show. And I have to say, again, thank you for everything you and your colleagues are doing. We appreciate it.
Appreciate it.